For patients with HER2-mutant non-small cell lung cancer, the treatment landscape is changing rapidly as targeted therapies offer new possibilities for improved outcomes. Understanding optimal testing strategies, emerging therapies, toxicity management, and therapy sequencing is essential to optimize results. Advanced non-small cell lung cancers harbor HER2 mutations in around 2 to 4% of cases, and these mutations are associated with a higher risk of brain metastases and poorer outcomes. Most of these mutations occur in the tyrosine kinase domain of the HER2 receptor, the part inside the cell that drives tumor growth and survival, and are typically exon 20 insertions, with the most common known as 𝗲𝗵𝗂. HER2 mutations are distinct from HER2 amplification or overexpression and are not reliably detected by immunohistochemistry or amplification testing. Comprehensive genomic profiling using next-generation sequencing, ideally with tissue biopsy, should be performed at diagnosis to enable timely access to targeted therapies. Understanding testing results through multidisciplinary team discussion is important to ensure the patient receives the most appropriate treatment. Historically, platinum-based chemotherapy, with or without immunotherapy, has provided only modest clinical benefit in patients with HER2-mutant disease, highlighting the need for more effective targeted treatment options. Trastuzumab deruxtecan, a HER2-directed antibody-drug conjugate, has improved outcomes in previously treated HER2-mutant non-small cell lung cancer, as demonstrated in DESTINY-Lung01 and DESTINY-Lung02. Responses were also observed in patients with stable brain metastases. Common adverse events included nausea, fatigue, neutropenia, and anemia. Interstitial lung disease or pneumonitis is the key safety concern, requiring early recognition, treatment interruption, and corticosteroid management. Next-generation oral HER2 tyrosine kinase inhibitors have also shown promising efficacy. Zongertinib, an irreversible HER2 TKI that spares wild-type EGFR, was evaluated in the 𝗵𝗵𝗃𝗃 study and showed promising efficacy in both previously treated patients and in treatment-naive patients. Intracranial activity has also been reported, an important consideration given the frequency of brain metastases. The safety profile is generally manageable, with mostly low-grade diarrhea and rash, and no strong signal of treatment-related interstitial lung disease. Sevabertinib, a reversible TKI targeting both HER2 and EGFR mutations, including exon 20 insertions, was evaluated in the SOHO-01 study and also showed promising efficacy in previously treated patients without prior HER2-directed therapy and treatment-naive patients. Activity was also observed in patients previously treated with antibody-drug conjugates, though with lower response rates. Responses were seen in patients with baseline brain metastases, suggesting potential central nervous system activity. The safety profile has also been generally manageable, with mainly low-grade diarrhea and rash, and no clear signal of treatment-related interstitial lung disease. Both agents have received accelerated approval by the FDA based on these data, with confirmatory Phase 3 trials ongoing. Next-generation HER2 TKIs cause manageable on-target toxicities like diarrhea and rash. With early recognition, supportive care, and dose adjustments, many patients can continue therapy while maintaining quality of life. As the treatment landscape evolves, new molecules and combination strategies are being explored. This highlights the growing importance of comprehensive molecular testing and careful sequencing of therapies. Ongoing Phase 3 studies, including 𝗵𝗵𝗃𝗃, SOHO-02 and DESTINY-Lung04, are evaluating HER2-targeted therapies in earlier treatment settings and are expected to further shape the evolving treatment landscape. Incorporating efficacy, safety, CNS involvement, and patient-specific factors is key to optimizing outcomes for our patients with HER2-mutant non-small cell lung cancer.